not every cough syrup you take that will work for that particular cough that you have. Now, as a pharmacist, I'm going to tell you the ingredients you need depending on the kind of cough that you need. So I'm going to talk about the two different types of cough that we have and the ingredients that will help you in any kind of cough that you may be suffering from. So just give me 2 minutes of your time and I'll be out of your faces. Then me and you can go and watch who? Sabinus. I want to watch Brain Jotters. If you don't think I watch them. Alright, so cough is a protective reflex by your body, understand, to clear your airways. Does it make sense? It means if it is reflex, it means you cannot control it. And cough is actually there to protect you. It removes mucus, irritants, foreign particles, viruses, bacteria from your airway so that you'll be able to breathe properly. Now, we have two types of cough. You know, we are now in the Harmattan season, so it's very important that you understand this. And a lot of creators have spoken about it, but I want to bring the drug aspect to you. Now, we have dry cough. Dry cough is when you cough and nothing is coming out. It's just dry. That is the kind of cough you find in Harmattan. So if you take syrups or expectorants, you are just wasting your money because it will not work in dry cough. Most cough you experience in Harmattan, they are dry cough. Do you understand? So the second, I will tell you about the drugs later. The second type of cough we have is productive cough. This one is not dry. When you cough, things come out of your mouth, sputum, mucus, you do all those, they come out of your mouth when you cough. So in that situation, that's when you need expectorant and the rest. Do you understand? Now, what can you take when you have dry cough? Now, there are two things you can take when you have dry cough. Number one is codeine containing syrup. Of course, you cannot get that in anywhere again. It has been banned by NAFDAC because, of course, a lot of my Nigerian brothers and sisters, they abuse it to get high. So that one, you cannot find it anywhere. It's no more in production, in fact. And then the one you can take is called dextromethorphan. That is the active ingredient, dextromethorphan. It is used for dry cough. A lot of cough syrup I see people coming to buy don't have that dextromethorphan in it. And that is the most important ingredient. I've seen 2 cough syrup for adults that have dextromethorphan. I know they are much, but this is the 2 me I've seen with my eyes. There is Emzoline. Yeah. Emzoline by, is it Emzo? Yeah. And Actifed. That one is very expensive, but it's one of the best medication you can take for dry cough. And Actifed, it has dextromethorphan. And is it pseudoephedrine or is it tripolidine? One of them. But these 2 medications is the one I've seen with my eyes. They are very, very effective when you have dry cough. So when you are coughing and nothing is coming out of your mouth, no sputum, no mucus, no anything is coming out of your mouth, that is dry cough. It is usually associated with Harmattan. Go and get drugs, syrup or whatever that contains dextromethorphan. It will help you. And then for the productive cough, the one that has sputum and the rest, you need to take expectorant. Now, expectorant will not stop the cough. It will actually make you to cough better. It's true. It will force all those things, all those mucus in your airways to come out. That's what expectorant does. You understand? The same thing with mucolytics. Mucolytics, they make the mucus that is thick, that don't want to come out. It will make it, it will reduce it. It will make it thin so that you are able to cough it out. Do you understand? So expectorants contain things like ammonium chloride. Then mucolytics like brohexine. You see brocolite everywhere. It's just the same thing. It will make you to cough better so that all these things in your airway will just come out and go. And then if the cough is related to allergy, right? Maybe you're allergic to one foreign body or something. That is when you see that many people use this antihistamine. They sometimes use Piriton, that's chlorpheniramine, or they use diphenhydramine. All these things I'm calling are ingredients you can find in a cough syrup. So when you go to a pharmacist, or when you go and buy this medication, or when the doctor prescribes a medication for you, you can just go there, look at the ingredients there. I have dry cough. What are you looking for? Dextromethorphan. That is it. If you don't know, if in fact, most of the time you will not see dextromethorphan alone. You only see it with either pseudoephedrine or you see it with Piriton or tripolidine or something like that. But just make sure dextromethorphan is there. Does it make sense? Now, when the cough is related to an allergy, that is when you can use Piriton containing syrup or diphenhydramine containing syrup. Now, for the adult dose, it's usually 14 milligram for diphenhydramine, while for the Piriton, or chlorpheniramine, usually 4 milligram. You understand? Most cough syrup are usually taken 3 times daily, 10 mils. For adults, children own day different depending on the child, but for adults that's above 18 years, it's usually 10 mils 3 times daily for most cough syrup. So I just thought you should know that. Okay. Even guanfacine, there's a medication called guanfacine, is also expectorant. You understand? You just make it to cough all these things out. Does it make sense? All right. So see you in my next video.